Lovely to welcome you today. As you can hear, the recording has started. So my name's Angela Gill. I work with Community First and all of the CVS network for Hampshire. This is a CVS network webinar today, and the Isle of Wight. Don't forget the Isle of Wight. I also work with Gosport Voluntary Action and with social prescribers, with the Clinical Commissioning Group, and with Citizens Advice Hampshire. So I have a number of different hats. What we're going to do is we've got 3 guest speakers and a video. First video we've ever played, so keep your fingers crossed. Firstly, once we start this, I'm going to introduce Jean Roberts-Jones. Now, Jean had a problem coming in. Has she arrived, Lynn?
Yes, she has.
Lovely, thank you. Welcome, Jean. That's really good. And Jean's going to look at how Hampshire's CVS network supports green social prescribing. And then from Jean, we're going to move on to Active Lives, which is a 3-minute video, and it really emphasises the importance of starting with increasing activity and encouraging people to be active. And the follow-on, hopefully, will be green social prescribing. Access to green and natural spaces for health and wellbeing support in Hampshire is the title of Dr. Lizzie Moore's talk, and Lizzie is from Public Health England, and that's South East. And obviously, as you can see, by the way, One Community, Jean Roberts-Jones is the Chief Officer for One Community. I think someone's got their mic on, I'm not sure, but I can hear some reverb. So if everyone has their mic turned off, that will be really helpful, particularly when we've got a large group. Then we move on to Active Outdoors, and that's Victoria Hild, who's from Energize Me. And Victoria will be talking again about the importance of being active, but in an outdoor environment. And right at the end, I'm going to confirm the date for the next Hanson Isle of Wight Social Prescribing Network meeting, which, if you were here at the very beginning, Suzanne was asking me about. And it's going to be, date for your diaries, 15th of September. And it's actually face-to-face. 12:30, sort of people can arrive, bring their packed lunch, etc. But the agenda will start at 1 o'clock, and it will be a 1 till 3 agenda at Fareham Community Church. And obviously, I'm hoping all of you are members. If anyone here is a guest and hasn't been here before, do contact Lynn Dudman to make sure that you are kept in the loop. So without further ado, I'd now like to introduce Jean Roberts-Jones, who's the Chief Executive of One Community.
Thanks very much, Angela. Hi, thanks very much. I finally got in, so thank you very much for inviting me along. Hopefully everybody knows what CVS stands for. It stands for Council of Voluntary Services. It's a fairly old-fashioned term now, but it does mean the infrastructure body for all the voluntary activities in a particular area. In Hampshire, it's divided by boroughs, and if you could move on to the next slide, please. That shows a map of all the areas and which particular CVS covers which particular geographical area. I'm sorry, I've got background noise, but I can't turn it off because...
That's fine, Jean, that's fine, it's fine.
So the Hampshire CVS network, if you go onto their website, you can click on your area and then you can get through to who your particular CVS is. The one that I'm going to start with that we're all involved in is community litter picking. It's very straightforward. It can be a group of people around a street, a park, or a wider area. And actually to do it, and here you've got all the bags, it's about involving perhaps your borough council, who will take the rubbish away, and people can recycle it. It's a very low level, getting to know your neighbours, getting involved in your local community, that people can start off with kind of, yes, that is volunteering, yes, I can get involved in what's going on. I can have the next slide, please. Sorry, as I said, I feel like a Boris moment when I say that. Moving on to perhaps more organised activities, and I've put down at the bottom that this will appeal to volunteers and people who don't feel particularly comfortable in crowded areas, who actually prefer their own space and actually being out and about, but perhaps working on their own. There are a number of areas that are going to be planting new trees, not least of all because of the Queen's birthday next year. Her whatever it is, 70th next year. But there's a lot of replanting of trees going on in the area, and that leads of course into more formal supporting country parks, local areas, green spaces, down to keeping paths tidy. Again, people can do that on an individual basis. There are a number of paths throughout the whole of Hampshire that Hampshire County Council would like people to keep that path going, and people can do that as an individual, or they can do that as part of being a community. Obviously there's also things like community gardens. Next one please. Community pantries, these have obviously played a big part in COVID, and again it's about encouraging people to be part of it. It's mainly supported by people on low incomes. Some of these are church based, some of these are not church based, and you have to be very clear that people understand where people are coming from, but it's about supporting people on low income, and appeals to a lot of people who are on low incomes themselves to actually feel that they're giving something back into their local community, as well as actually getting food at a price out of it. Move on. Thank you. Repair cafes. Again, it's about that reuse of materials. There's a lot of them springing up, mostly in community centres around the area, where they're encouraging people with certain skills to pass those on. Obviously with things like the sewing bee, everybody's got very involved in it, but it's about reusing materials, learning new skills, and being involved in that whole recycling project. So I've put down there just some of the ones. Here in one community, we've got bottle tops coming out of our ears. It actually makes us money. We recycle laptops, we get them cleaned, and we pass them on to people who could benefit from them. Recycling projects with actual cycles, encouraging young people to look after a cycle, their own bicycle, and if they turn up at the project, very often they can have their bike at the end of 3-6 months. And even things like shredding. Shredding goes to animal bedding. Certainly that's where all our shredding goes to. So it's about teaching new skills as well as being involved in their local community, which is really what volunteering is all about in this area. This is the one that probably most people think about when they're talking about green and environmental projects to get involved in. It's the Healthy Walks projects. Every area will have one that's either led by borough councils, sports activity workers, voluntary sector, individual, by client group. Some of those are fixed around cultural issues, some around historical issues, even local duck ponds, which goes back to keeping the paths and all the activities open. Mixed group of people can feel they can come. They don't have to talk to anybody. They can even become leaders. It depends on where they want to go with everybody. Sorry, somebody's put something in the question. Are the Healthy Walks back up and running? They are very often, but only with small groups. It depends, of course, on your borough and what facilities you've got. But here in Eastleigh, our Healthy Walks coordinator has been going out and encouraging people in groups of 6. That makes sense. They can do that, and then they can add other people as they come on board. So yes, they are starting in most places now already. Okay, and if I could move on perhaps then to the last slide. There are lots of other initiatives across the whole of the patch, and if we're talking about the whole green agenda, don't forget the good old charity shops. Most of them are back up and running. It seems very strange now, but you actually have people on the door, often described as bouncers on the door, to stop people coming in. But the charity shops are up and running across the patch, and again, it appeals to some people who need that social support and getting back into volunteering, and maybe even a means to work. But it's about them feeling part of their local community as well as supporting a green environmental agenda. CVSs don't necessarily run these projects. Some of the projects I've talked about, there is one in Eastleigh about practically everything I've talked about, but we don't necessarily run them. But we all know where they are, when they're opening, and what they're doing. And equally, if somebody identifies an area, we can help getting a new one up and running. We know backwards and forwards all the regulations, even things like how to start a bank account. If you're running a small repairs cafe, you may need to have a bank account to be able to count monies in and count monies back out again. We are here to help you to be able to deliver the services. So if you don't know about a service, talk to the CVSs. We may already know what's going on. All of us across Hampshire are going back to all of the services we knew about pre-COVID to double check whether they are open, what they're doing. Some of them are starting very slowly, some of them are starting a little bit more fast, just like the walking groups. As I say, ours are working with 6 people groups, whereas before they were working with perhaps 30. So people are restarting very, very slowly, but all the CVSs across Hampshire will know what's happening in their patch. And that is our wider agenda. I mean, that's the agenda perhaps of all the CVSs, as we say, on a regular basis. It's about, we often know who, where and what. Please ask us. Never start with a blank sheet of paper and without talking to us about what's going on in the area. There's lots of other things around, boats and environmental, depending on what your area looks like and what people's particular interests are, whether they want to do formal volunteering, informal, they want to do it on their own, they want to do it part of a group. They have varying abilities, including physical disabilities, that maybe they would think, oh, maybe I can't do that. Well, maybe they could do something that supports it in their area. Please do talk to us. So thankfully, that's my last slide. That's me. If you want to ask me any information, very happy to answer questions afterwards. I've picked up quite a lot in the chat room, so I will go through.
Jean, we've got a couple of minutes, so I can only see the presentation, but could I ask you to look in chat and could you read out any of the comments which are pertaining to your talk or any of the questions and share them? We've got a couple of minutes, so we've got time to do that, please.
As about the healthy walks, which is that people are saying up and running, yes, it is. Again, in the rural areas, there may well be other people who want to hear about village agents and what they do. And of course, in rural areas, of course, the opportunities to go out and about in the environment are completely different to, say, in the centre of Eastleigh. But again, village agents, CVSs will know what they are. You go down a little bit. Sorry, it's hard to read the questions and keep going. Again, the Ramblers, very formal group of people, a lot of them going out and about, a lot of them restarting, you know, as we come out of lockdown. I think certainly with the good weather, I think it's one of those things that people are going to go back into there. I've put up my email, so that's okay. And I'm sure you'll put the slides. Somebody's asked about the display contact slide again. Yeah, that's there. I'm sure, I'm very happy for all those slides.
Do you want to see the contact slide again? I can put it back up, but we will be sharing all of the PowerPoint. No one needs to make notes. Lynn, if you're not a regular, Lynn always circulates the PowerPoint, so you don't need to take any notes today.
Yeah, very happy for that, and happy to take any emails afterwards if anybody has got a particular query. Very often through our network, and it's a national network that we're part of, if people have got a kind of very niche idea, there may well be another one operating in a place like, I don't know, Bradford or Worcester or somewhere like that, that we can actually ask people, has anybody ever done one of this before? It's not about starting with that, as I say, that blank sheet of paper. Please do talk to us about what that might mean. And people will come to us and to other people with their own ideas and about, sometimes it's great to start something new, but sometimes it's better to link them into an existing group rather than start a completely new one to do that, depending on what their particular issue is.
That's great. Now, please do keep making comments and questions for Jean, but we're going to move on to our next slot now. So thank you very much, Jean. We've got a very short video. You may be aware that the Wessex Academic Health Science Network are involved with what's called an Active Lives programme, and it's all around healthy ageing and activity. And they've produced a very short 3-minute video, and it sort of demonstrates in some ways the importance of activity, and the hope is that people will increase their activity levels and then they would consider potentially green social prescribing. So I'm now just going to play the short video.
As we age, we can experience problems like pain, fatigue, cognitive decline, depression and falls. The good news is that physical activity helps both prevent these problems and treat them once they've started, so older people can have less symptoms. The problem is, it can be hard to stay active as we get older. People sometimes lose confidence with being active, don't know how to get started, or find it hard to fit into their daily routines. Active Lives is here to help. Active Lives is an evidence-based website which was designed with 59 older people, doctors and physical activity experts. It helps people to gently increase strength and balance, moderate activity, and to take breaks from sitting. The website is tailored to people's needs. So for instance, if people are currently having quite a few problems with strength and balance, then they begin with chair-based exercises and can gradually work up to standing over time. Whereas those that report no problems with strength and balance at the beginning can actually begin with standing exercises which are more challenging. The website draws on the benefits of increasing activity that older adults value, such as protecting memory and improving symptoms. It addresses common concerns such as whether it might be painful, tiring or safe to be more active. There are helpful tips on how to increase activity, videos of easy strength and balance exercises proven to fit into people's daily routines, and people can track their steps or other activity goals. We conducted a trial with 360 older adults. By 12 months, those who used Active Lives increased moderate physical activity by 173 minutes a week more than the control group. They also increased strength training by 54 minutes a week, and there were no adverse events such as falls. Active Lives is free for older adults to use. You can find out more details on the Active Lives website. On the website you can find leaflets and other materials for you to give to older people who want to use Active Lives, and you can preview the patient website.
That's a brilliant example of the University of Southampton working in partnership with the Wessex Academic Health Science Network. So the reason we played that is just to sort of link in the importance of active lives leading into green social prescribing. So what I'd now like to do is to introduce Dr. Lizzie Moore, who's Public Health Registrar for Public Health England South East.
Thanks, Angela. Hi everybody, as Angela said, my name is Lizzie. I'm a public health registrar, which means that I'm a public health doctor in training to become a consultant, and I'm currently working with PHE South East and quite closely with the New Forest National Park Authority on strategic approaches to health and wellbeing for the national park. And I think I've spotted a few people on this call who I've met before over the past few months, so that's really great to see some familiar faces. So I'm going to talk today about access to green and natural spaces for health and wellbeing. Andrew, if you could just move the slide on a bit. Thanks. I'm going to talk about different definitions we use for green and natural spaces, a bit about health and wellbeing benefits of the natural environment, but also the inequalities that are faced by certain populations in access to these spaces. and then talk about nature-based health interventions, which is specifically relevant to green social prescribing, and then a little bit about what is needed and where we go from here. And then hopefully we'll have time for questions. Okay, so with the next slide. So in terms of what we're talking about, there's lots of different definitions used by different organisations and reports with respect to green space and health and wellbeing. So the word green space is used, green and blue space, referring to water-based areas, the natural environment, nature, green and natural spaces. I'm going to use the term green and natural space, referring to both green and blue spaces in towns and cities, and also the countryside and also the coast. So just to take a kind of broad approach to this from this in terms of this presentation. And then when it comes to green physical activity, that refers to any physical activity taking place in a green or natural space. And then I'll talk a little bit more about nature-based interventions to define that later on. Okay, so the next slide. So health inequalities, I have a feeling that I'm going to be preaching to the converted when it comes to this, but just as a reminder, so we're all on the same page. When we think about health inequalities, we're talking about avoidable, unfair and systematic differences in health between different groups of people. And that could exist not just as a result of deprivation, but could be associated with other characteristics, including certain geographical areas, so rural-urban divide, for example, protected characteristics such as age, sexual orientation, ethnicity, or members of specific vulnerable groups such as homeless people and gypsy and traveller groups. The next slide, please, Angela. Okay, so we know that a large proportion of these differences in health outcomes occur due to differences in social, economic and environmental factors that shape our lives. And we refer to these as the social determinants of health. And they are responsible for up to 50% in variation in health outcomes between the most and least deprived areas. So this diagram that I've got here is by Barton and Grant from a paper that they published in 2006. And it's adapted from a very famous, in the public health world at least, social determinants rainbow called the Dahlgren-Whitehead model. So this actually goes further than the initial conceptual framework for social determinants and includes it includes global ecosystems, climate stability, and biodiversity, all as factors that influence our living and working conditions and therefore our health. So this is a really comprehensive understanding of ways in which our health is intrinsically linked to health of the natural environment as well. Okay, next slide, please, Angela. Okay, so this is a reminder of a very famous report by Michael Marmot that was published back in 2010. And this looked at health equity in England. This was one published earlier this year as an update of a previous report. So we know that life expectancy has stalled since 2010, and the health gap between the most and the least deprived is widening. And the point that I want to make about this is that place really matters in terms of our health, how healthy we can expect to be. So we know that under 75s are 3 times more likely to die in the poorest 10th of the country than the richest 10th of the country. And in the recommendations that Marmot put together based on his findings, included creating and developing healthy and sustainable places and communities. The next slide, please. So this is a quote from the 25-year environment plan, and I wanted to include this as a recognition that place and the natural environment and access to green spaces is really now seen as kind of mainstream in terms of influencing our health outcomes. And this is an environment policy rather than health policy. So this states that spending time in the natural environment as a resident or visitor improves our mental health and feelings of well-being. It can reduce stress, fatigue, anxiety and depression. It can help boost immune systems, encourage physical activity, and may reduce the risk of chronic diseases such as asthma. It can combat loneliness and bind communities together. In addition to the green and natural environment, featuring in health and environment, key health and environment policies, we now see a new development in terms of social prescribing, with nature being one of 4 core zones of social prescribing, and I'll speak about that a little bit later. Okay, so next slide, please, Angela. So what are the mechanisms by which green and natural spaces improve our health and well-being? So there's four different ways that we can look at this. So the first is physical activity. So people may enjoy and are potentially more likely to repeat an activity if it takes place in a natural setting as opposed to a gym or equivalent. In terms of recreation, this could include health and exercise-based recreation, so walking the dog helps people to relax and unwind, or just enjoy the scenery where they are. And we know that from recent analysis of data held by Natural England, adults who had 2 hours of recreational activity a week in green space are more likely to have better self-reported health and well-being than those who don't have that exposure to the green space. In terms of community and social cohesion, we know that places where people can come together to engage in social activities help people feel connected to their communities. They help minority groups become better integrated and identify with their new communities. And they reduce isolation and loneliness by providing an opportunity to participate in shared social activities. And then nature connection is the last one. And this is a bit more of a conceptual idea for many people, but it can be defined as an individual's subjective sense of their relationship with the natural world. And there's emerging evidence that connection to nature is associated with particular well-being and educational outcomes, but also with pro-environmental behaviours, which obviously is really important to our health and well-being in the long run. Next slide, please, Angela. So this is just to highlight that when we're looking at time spent in nature, we're looking at access and the amount of time spent in nature, but also how well we're connecting to our environment. And we know from research that nature connectedness is influenced by contact with the natural world, but also our childhood experiences, our sociocultural status, and the stage of life that we're in at the moment. So younger people have a much higher connection to nature than in adolescence, and adults have a higher connection than adolescents, but it doesn't return to the level that we experience in childhood. Okay, next slide, please. This is some sort of headlines taken from a really useful report called Improving Access to Green Space 2020 review that was published by PHE last year, and it's just some headlines from a large body of research into health outcomes and health behaviours associated with exposure to green and natural spaces. I'm not going to read all of these out, but I will just highlight that many of these effects have shown to be greater for groups with lower socioeconomic status, and I'll come back to this in a little bit. So the next thing to start thinking about is how our access to green and natural spaces is unequally distributed, and the likely health effects of that at the population level. So we know that 1 in 8 households has no access to a private or shared garden. We know that Black people are nearly 4 times as likely as white people to have no access to outdoor space at home. And almost 40% of people from ethnic and minority backgrounds live in the most green space deprived areas compared to 14% of white people. So that's a big inequality. We know that people on low incomes are less likely to live within a 5-minute walk of a green space. And I just wanted to highlight as well that I've mentioned several kind of physical barriers to access to green space. But barriers are also sociocultural, they could be emotional or psychological barriers as well. And we have to consider who feels that they have a stake in green space and nature and how that impacts their access and connectedness. Next slide, please, Angela. So this is to highlight the what we call an ecogenic effect of green and natural spaces as a means of addressing health inequalities in a population. So as I mentioned before, disadvantaged groups are known to gain larger health benefits from improved access to green space. And also socioeconomic health inequalities are lower in greener communities. So it doesn't just depend on what the community looks like, but also how people are supported to access those green spaces. And I'm not going to explain the chart there because that will take some time, but there's a really key paper by Mitchell and Popham, which was published in 2008, which really highlighted some of these effects in a very clear way. Okay, next slide, please. Okay, so coming on to what's called nature-based interventions, and this is where green social prescribing is relevant. So these can be defined as activities and programs to promote health and well-being, which include exposure to nature as a core element. And as I mentioned, this is that nature is one of 4 core zones of social prescribing for the National Academy of Social Prescribing. The interesting thing about these type of interventions is that they're what's known as complex interventions. So that means any intervention which has multiple or complex pathways to benefit individuals. And they might contain several different interacting parts or components. And these interventions often rely on relationships between people in addition to the setting and the activity as well, which makes them really interesting to evaluate and develop a really kind of robust evidence base around. And I'm not going to read out the list of activities which would be described as nature-based interventions. So I'll just let you look at that and come back to it in the slide set. So the interesting thing about nature-based interventions is that they're thought of as being sustainable in 3 different ways. So generally speaking, they're socially inclusive. They also have low environmental impact and they're low cost, so low financial impact of the intervention. And we also know, as I mentioned before, that there is a positive impact on pro-environmental behaviours and wider social attitudes towards nature and the environment. So we've got that kind of positive feedback loop in terms of intergenerational equity. So this slide is taken from a DEFRA report that was published this year, but based on some research by the University of Exeter in 2019. And they looked at what works in terms of nature-based interventions. And what they found was that due to the complex nature of these interventions and the relatively limited research based on specific interventions, they couldn't say exactly what did work, but they did characterize certain aspects of interventions which seemed to be effective. So those are ones which used theory-based design, so a clear kind of logical framework as to how individuals and populations are benefited. Those which build on best practice, those which target the intervention appropriately to specific groups, those which engage communities and are flexibly implemented, designed and implemented, where they're embedded within wider provision, so a systems-based approach, and where they use behaviour change approaches, so using behavioural science, and also where they're based within settings, which could be a social care setting, a school, a hospital, etc. I'm just going to finish on this slide, just to highlight that whilst we've talked about the value of nature-based interventions to address health inequalities, it's really important to remember that the structural determinants that influence our access to green space. So it's all very well providing programs that target specific underserved groups, but unless we change the environment so that access to green space and nature is just part and parcel of our daily lives, we're not going to reach the kind of left-hand side of this, the right-hand side of this illustration, which is to achieve justice for all. I'm going to finish there. I'll leave the conclusions up on the page, and there'll also be a list of resources at the end of the slide set, which you'll receive from Lynn after this session. Thank you.
Thank you very much. Sorry, I went out of sync there with you, but that's fine.
I'm so sorry, I forgot to say next slide.
No, it's fine. It's fine. It's not a problem at all. So thank you very much. So what I'd like to do, Lizzie, is to ask if you could have a look at chat.
Yeah.
And just see, are there any comments or any questions that you could read out and respond to, please?
There's one from Suzanne Pepper.
Okay, so Lizzie, do you want to read that one out?
Suzanne Pepper, okay. How much engagement do you have with local councils, especially planners, to encourage use of many green spaces? Or I think there's a bit missing on that. But about how much engagement do you have with local councils? So at the moment, I'm as I said, I'm working with the New Forest National Park Authority, and we've been undergoing an extensive period of consultation with various different stakeholders. And what we're trying to do is to create very much a kind of systems-based approach with structures that underpin better access to nature. And we know that no one organisation can do that alone. It has to be through partnership approaches. So the National Park Authority is doing what it can to work with the appropriate local government departments, which would include planning in terms of, green active travel routes and so on, to ensure better access to green space and nature. But that's a kind of it's a long-term project, so none of this can be achieved overnight. So I hope that answers the question, Suzanne. I don't know whether you wanted to add anything.
Great, thank you. Okay, are there any others?
I'm so sorry, the rest of them seem to be about the slides being muddled up, and which might
we weren't in sync there, were we? Sorry.
I'm so sorry.
No, it's fine. No, thank you very much indeed. So Lizzie is going to keep an eye on the chat, so that's fine. If there's any other comments or questions, then please drop them into chat. And I'm now going to introduce Victoria Heald, who is Regional Physical Activity and Health Lead South East for Energize Me, who's going to talk about active outdoors.
Thanks, Angela. Hi, everyone. It's great to be here today, so thanks for having me. I'd also like to thank, just while I'm getting the thank yous out of the way, my colleagues Maya and also Emily and Helen, who've helped me to pull this presentation together, so it isn't just my work. I can't take credit for it all. So as Angela said, I'm Victoria. I'm the Physical Activity and Health Lead at Energize Me, which is Hampshire and Isle of Wight's active partnership. I'm sure many of you on this call are very aware of Energize Me. My role, I started back at the beginning of January, so I'm relatively shiny and new, but it's to work across the South East with a range of partners to embed physical activity into social prescribing. Today I'm going to talk about using the outdoors to be active. I'll provide a bit of context around that, kind of the national and local picture, and share some examples as well of how being active outdoors has supported social prescribing in Hampshire and the Isle of Wight. So if we could go on to the next slide, please, Angela. So I thought I would just share some of the benefits of being active for our health. We've already heard from Lizzie some of the benefits of nature on our health. So I'm sure you'll see this and you'll see a lot of similarities across the two. Physical activity has both physical and mental well-being benefits. It can reduce the health risk of a range of conditions such as diabetes, hypertension, bone density, some cancers, coronary heart disease. You can see them all on the slide there. And as well as kind of, I think the biggest reduction there is around kind of falls prevention and bone fractures, and a reduction in depression, which is a 50% reduction in depression for people who are active. And just keeping on mental well-being, it actually reduces kind of isolation, improves social interactions. It can provide a source of enjoyment and happiness. It can improve confidence, self-esteem, and cognitive function. So it can all of those things can kind of lead to increased productivity. And I guess I've just put a quote on that slide there from the UK Chief Medical Officers around being active that say that, it really is a miracle cure. And I guess imagine the double benefits of kind of being active outside in nature. So if we move on to the next slide, I just wanted to touch on the fact that the reality is not everybody is active. So actually, in fact, 22.6% of people in Hampshire and the Isle of Wight are classed as inactive, which means they do less than 30 minutes of activity per week. And there are some communities who are more likely to be inactive than others. So that's women are more likely to be inactive than men. People with a long-term health condition are twice as likely to be inactive than those without. And families on lower incomes find it much more difficult to be active. And I guess just to touch on top of that, we've yet to see the true impact of the pandemic on people's activity levels. One survey has shown that 20% of people were doing a lot less activity than before the COVID restrictions. So I think that's one to keep an eye on there in terms of activity and the true impact of COVID on that. So just to give a bit of context and what's happening regarding social prescribing, I guess the short answer is quite a lot. I will give a bit of a longer answer though, I'm afraid. So we'll be on this slide for a while. So nationally, the National Academy for Social Prescribing are creating partnerships across arts, health, physical activity and the natural environment. And actually that's where my role has come from. And they're doing that to kind of promote health and well-being through social prescribing. And they're doing that both at a national, regional and local level. There's also a kind of a cross-governmental project that is 7 green social prescribing pilot sites that's happening across the UK, which is a £5.7 million investment. Unfortunately, none of these are in Hampshire and the Isle of Wight, but I am involved in the Surrey pilot, and that is at its very initial stages, and they're just kind of trying to figure out what they're going to do with that project at the moment. But as soon as I've got more information, I'm happy to share that. Or, you know, if you also in your roles work in Surrey, then, you know, and want to be involved in that, then let me know. And then regionally, we've got Natural England, who have regional health and environmental leads, and they're working to develop green social prescribing across their work programmes. And again, the National Academy for Social Prescribing are supporting 6 projects through their Thriving Communities programme, 6 projects in the southeast, that is, and 2 of those are in Hampshire and the Isle of Wight. And that's all about linking nature, linking arts, linking physical activity together with social prescribing. So they're again in their infancy, but watch this space. The National Academy are also running a learning programme for community organisations, which kind of to help community organisations connect with social prescribing better. And then finally, just on this slide, in Hampshire and the Isle of Wight, there's the We Can Be Active movement. And this is a joint strategy for physical activity. And I'm sure many of you on this call have been involved as that's been developed and is currently still being developed. But one of the key themes that is coming out of that is active environment. And that is going to have an aim of creating spaces that feel safe, warm, welcoming and attractive for people so that they can be active in. And I think it's, you know, it's great that they're recognizing that being active isn't just about the activity that's on offer or the activity that people do, but actually the places that people are in really help to facilitate that activity. So that's some context for you. I'm now going to move on to some examples. So we heard earlier from Jean about the healthy walks, and I just want to bring that to life for you a bit by introducing you to Cliff. So Cliff is 75, he has COPD, which is a respiratory disease, and he was really struggling with breathlessness. So he went to visit his GP, and through social prescribing, he joined a local walking group. 2 years later, he no longer needs to use his inhalers, he's lost 21 pounds in weight, and he's improved his mental health, and he's made dozens of friends through it. So you can see the impact that that has on people's lives. And as Jean said, these walks are taking place all across Hampshire and Isle of Wight, and they're suitable for all abilities. So, you know, a huge number of people could benefit from those. And then keeping with the theme of walking, my next example is the walk and talk sessions, which take place in Romsey. Now, these walks give new mums the opportunity to meet other new mums. They get to talk with like-minded people and reap the benefits of being active. But that's almost like a side product. It is about the talking that's more important, really. And these were initiated by a GP who noticed that he had a lot of new mums coming into his surgery who were experiencing isolation and poor mental well-being at their 8-week postnatal check. The GP approached Energise Me to see if we could kind of support and help these ladies. Energise Me then facilitated discussions to kind of to work out what it was that would be an appropriate session for them. And they also talked with the National Childbirth Trust, I think it's called, NCT, to really determine what could work in this field. And then that's where Walk and Talk came from. So I guess the point on this slide is if you identify a need or a gap in physical activity opportunities, you know, get in touch. We may be able to help you to fill that gap. Or if we can't, we'll put you in touch with somebody who may be able to. So The final example that I wanted to share is a project called Pedal Project. And this is an inclusive cycling project that's run by the charity Friends of Pedal and the New Forest National Park Authority. It is supported by the NHS, a charity called Scarf and Colton Care, and it's also funded by the National Lottery, Sport England and British Cycling. So it's a real partnership project. They use a range of specialist cycles which take place off-road, which makes them safe and amongst nature of the national park. The rides have previously focused on young people with additional needs, but they've actually recently received some additional funding from the National Lottery Community Fund, which has enabled them to expand that out for people with dementia, mental, physical and behavioural challenges. And they now offer kind of confidence rides to help support people post-COVID as well. And broader than that, they actually have 25 volunteers that work with them, and they've got a GP who sits on the board. They provide work experience and apprenticeships for all range of abilities. So it's much broader than just physical activity. There's a lot of information now on that slide, so do have a look and access it if you would like to. So I think the next slide is just a picture, so you can see Pedal in action, and also there's a quote on there which really kind of brings to life what the impact that these kind of projects are having on people. So I guess just to tie up, physical activity is our goal at Energize Me. It might not be yours, but it can certainly help you to achieve yours in what you're trying to do. And I think in Hampshire and the Isle of Wight, and on the next slide, I think, Angela, there's just you'll be able to see just a rough idea of how much blue and green space there is out there, which enables and supports people to be active and connect with nature in. So that's pretty much all from me. There's the last couple of slides have just got some information on there around where you can find out a little bit more. It's not exhaustive, so please, if you know of more, add them into the chat. I will also add these links into the chat, but that's me. So if you've got any questions, then give me a shout.
Thank you very much indeed. So Victoria, can you have a little look at chat and just see if there are any either comments or questions for you, please?
There's one there from Nikki Dodds about what about new dads?
What about new dads? I don't know, but it's definitely something to explore. I know that I don't know whether that happens in Hampshire. I know they do happen in other parts of the country, but I don't know in Hampshire, I'm afraid.
Okay. Any other questions for Victoria?
I can't see any.
Okay, that's fine. What we'll do, Victoria, can you just keep an eye on chat in case anyone puts a last minute question? That will be really good. So despite the challenges, I'm sorry that I lost track with Lizzie, so I was really sorry about that with the slides, but you will get the PowerPoint, so you can watch, you can look at the PowerPoint in exactly the right order. I just want to say, first of all, thank you to all our presenters, to Lynn for being my right-hand woman at the back there with the audience, and also the audience without the audience here. And I think the number, is it about 83, which has broken all records for one of our webinars?
Yes.
Which is amazing. What it shows is a real passion and interest in green social prescribing, from people who already know what that is to people who have come to find out a little bit more about what green social prescribing is. So really fantastic numbers today. Thank you very much. If you didn't have time to ask a question, or you thought of one later, not a problem. You can email the presenter, and the PDF PowerPoint that will be circulated has got all their contact details. Please do feedback by chat or to Lynn via email. Thank you for your social prescribing webinar theme ideas today. Again, we're always open. We program about almost a year in advance with all the different ideas and themes, but we're also sometimes quite responsive. Obviously with COVID, we built something in quite quickly around that. So please do continue to share your thoughts. as I said at the beginning, the webinar, the PowerPoint and the corresponding documents are all going to be available via the Community First and Gosport Voluntary Action websites. It takes about a week because we've got to download and also get some text, etc. But approximately by the 23rd of June, that will be available for you to share with others. Or so just to have a little look at the dates. Shock horror, the next meeting is actually a face-to-face. So we're biting the bullet, and what we're going to do, and I was saying to Suzanne at the beginning, we're going to alternate now and just see how that goes. One face-to-face meeting, network meeting, because it is really important to network, and that has been lacking. As we all know, when you're on Zoom meetings, there's only so much networking that you can do. So it's going to be face-to-face. It's at Fareham Community Church on Wednesday, the 15th of September. 12:30 will be when people can arrive and bring their sandwiches, etc., and just informally chat with others. The formal programme will start at 1 o'clock. So it's 1 till 3, and that is going to be face-to-face. Then 8th of December, we've got a webinar theme to be confirmed, and then moving on to 2022, which seems a long way away. Meeting, we're going to have a face-to-face meeting, and again, venue will be confirmed nearer the time. So I just want to say thank you very much. I'm wishing you all a really happy and a healthy summer, which, as we know, in the past year has been so important. So thank you very much indeed, and have a good afternoon, what's left. Thank you.